Good afternoon, everyone. Good afternoon. And it is a good afternoon. I want to wish you, my name is Chaplain Sandra Mitchell, and I'm one of the leaders in the Access to Recovery Coalition, which we will be introduced later on. But I just want to welcome you for spending your precious time with us. Happy Transformative You New Year 2022. Yay! I want to introduce you to a way that we're going to be doing town hall meetings that probably haven't been done before. We are working in close collaboration with the Office of Mental Health, with OASIS, and with the Department of Health and Mental Hygiene and the Department of Consumer Affairs. We are working together, finally, to be able to bring you new information for changes that are coming down the pipe. I want to introduce CORE, Community-Oriented Recovery and Empowerment, CORE. And it's going to be a town hall series hosted by us. And I am one of the members of the Access to Recovery Coalition that was created last year in August, also known as A2R. So I'm going to let the speaker introduce themselves, but first, we want to go over some community agreements. If we could have that slide, so we can just have a smooth meeting. If that's okay, if we can have the slide for community agreements. Thank you so very much. I appreciate Chris is at the helm and helping us to move our meeting along. And I want to say thank you to Chris Coyle from ONH. First, I just want to touch on the format. We're going to have topics. We'll talk about the topics, we'll introduce them, and then we'll have feedback and questions. And then after the feedback, after the presentation and feedback and questions that are going to be intermittent, then we'll have breakout rooms. So if you don't get a chance to ask your question during the small breaks in between the presentation, join us in the breakout rooms, and then we'll have more time there. So, community agreements. We just have a few. We have seven to keep us complete. Number one is nothing about us without us. We know that. A lot of times there are decisions that are made and we don't know. And then it trickles down to us and it really doesn't help us. But not this time. Nothing about us without us. That's our motto and that's how we're going to move forward. Number two, one mic and move up, move up. It's okay to say, it's a draft or we're working on it. So one mic, we're going to speak one at a time so that we can hear the message, sort of marinate it, think about it, and we can always write our question down so we can share that later. Number three, speak from your own experience. This is the time when you can say, I think, or I need, or I don't like. This is the time when you can speak from your experience. But we want to keep it positive and we want to keep it tight. So you can use I statements and we understand. Number four, learning and sharing mindset. And it's a safer space. So I learned from you, you learn from all the presenters, and then we put it all together to make sure that we have a safe space to communicate and a safe space to learn and a safe space to share. Number five, mindfulness. Mindfulness around oppression and power. So there's no big I's, there's no little U's. It doesn't matter what our title is. It's about people and coming together so that we can have better support services for healing. Number six, we're part of a longer journey. Yeah, there's been a lot of changes. There's been some merging, and we want to make sure that we understand what that means to us and having our support services. And it's a longer journey. So we may have some questions. We might have to work out some kinks, but we'll put it out there and we'll work through it together. So you might leave with some questions or you might leave with some ideas, but you can always contact us and we can continue on the longer journey. And number seven, it's okay to say, I changed my mind. It's quite okay. Because the more information you get, the more you process it, you may change your mind. So I want to thank you. These are our community agreements. And we're going to now start the core presentation and sharing information with you so that you'll be well informed to be able to continue to get the support services today. We are going to start with our very own Emily Herzl, and she will introduce herself and tell us what office she is coming from, and she will lead us in our town hall meeting. Thank you, Miss Emily.
Thank you so much. We're so excited to be here. So my name is Emily Hetzel, and I work for the New York State Office of Mental Health in the Division of Managed Care. And I'm part of the team that's been working over the last year to implement core services. So would you like me to start with the presentation or kick it over to my co-presenter, Katie, to introduce herself?
You can introduce Katie so that we can know that she's coming directly after. Katie, would you like to introduce yourself? Okay. And then we'll go back to Emily Herzl. Thank you so much.
Sure. My name is Katie Merrill, and I work here at the Office of Mental Health in Albany. And I have been working on adult behavioral health, home and community-based services, and now community-oriented recovery and empowerment services since they were first implemented back in around 2015. I'm very excited to be here with you all today.
Thank you so much. So Emily, please take it away.
Thank you. Chris, would you mind going to our first slide? Perfect. Okay. So the purpose of this presentation, oh, can you go back one, please, Chris? Okay, perfect. So the purpose of this presentation is to inform people who are interested in learning more about community-oriented recovery and empowerment services, also known as CORE, and to understand how the services can be useful, who can access them, and how to access them. So, as mentioned earlier, the Office of Mental Health has worked very closely with our partners at the Office of Addiction Services and Supports to incorporate stakeholder feedback throughout this program design. Again, we just wanted to thank you for the opportunity to speak with you today, and we're really excited to share these details with you. The other piece of this is that throughout this presentation, there are going to be a lot of acronyms used on the slides. We are going to do our very best to tell you what they mean and put them into context as we get into some details. Next slide, Chris. Okay. So the first piece is, what is HARP, HIV, SNP, VHHCS, and CORE? The first thing I just want to bring your attention to is that purple box up at the top. We're going to be referring to behavioral health services throughout this presentation. And behavioral health services is a phrase used to refer to mental health and addiction supports that are paid for and covered by Medicaid. So now on to the next couple acronyms. HARP is a health and recovery plan, which is a type of Medicaid plan that provides more behavioral health services than standard Medicaid would. The state uses an algorithm run by a computer to determine who is eligible to enroll in a HARP plan. The algorithm looks at an individual's historical use of services, which includes hospitalizations, emergency revisits, and other kinds of services used, in addition to the level of intensity and amount of services an individual has received over a certain period of time. Right now, the algorithm is the only way to become eligible for a HARP. There is no community referral option as of yet. So on to the next acronym. An HIV SNP is an HIV special needs plan, which is a different type of Medicaid plan designed for people living with HIV. If someone is enrolled in an HIV SNP, they may also meet that algorithm criteria, which would make them eligible for HARP, which means they can access some of those additional behavioral health services while still enrolled in their HIV SNP. These services, and we're moving into them, include BHHCBS, which is Behavioral Health, Home and Community-Based Services, And so these are behavioral health services, again, available in the HARP or the HIV SNP for eligible individuals. And then lastly, also included in the benefit packages for HARP and HIV SNP are community-oriented recovery and empowerment services, or core services. Core services are a new set of behavioral health services. And it's important to know that if you've ever received BHHCBS in the past, some of those services available in BHHCBS will be converting to core services. In a couple of slides, we'll take a look at the breakdown so you can see if your services are going to be impacted by this change. Next slide, please, Chris. Okay, so quick recap, health and recovery plans, or HARPs, and HIV special need plans are Medicaid managed care plans that cover or pay for more behavioral health services than a standard Medicaid plan would. The idea of these services is to, get you the support you need to meet your goals. These services can help you increase your overall wellness, improve life satisfaction, build or improve relationships in your personal life, help you live independently, go to school, and find or keep a job. Next slide, please. So what we have on the screen right now is a visual representation, some charts of what I explained on the previous slide, which shows how the HARP or HIV SNP may lead you to more behavioral health services, which are core services, and BHHCS, or the behavioral health home and community-based services, if you're eligible and interested. So HARPs and HIV SNPs have some key benefits that are important to be aware of. In addition to offering core services and BHHCS, these Medicaid plans also include additional behavioral health staff at your managed care plan, enhanced care coordination, and additional support for a higher quality of life. Most of the rest of today's presentation will focus on core services specifically, because that's what we're here to talk about, and they are rolling out in early February. Core and BHHCS have different referral and intake pathways. And our goal today is for you to walk away feeling confident that if you're interested in core services, you have some good next steps to get this important benefit. Next slide, Chris. So before we go into details about what core services are exactly, it's important that we talk about how you would know if you're eligible and if you're enrolled in the right type of Medicaid managed care plan to get them. First, to be enrolled in a HARP, you need to be to be enrolled in a HARP, and also to access BHHCS or core services, you need to be at least 21 years old and enrolled in Medicaid managed care. You need to be found HARP eligible based on the type and number of mental health or addiction services used. And again, this is determined using the algorithm I mentioned earlier in the presentation. Once identified as HARP eligible, you will be enrolled. You need to be enrolled in a HARP or HIV SNP. For many people, HARP enrollment happens automatically. Although if you are eligible, DOH can help you enroll into a HARP plan if you would like to do so. Finally, once you're in the correct type of plan, you would follow the referral and intake process for core and BHHCBS to receive them. If you have questions about your eligibility or Medicaid enrollment, you can contact your health plan directly or call New York State Medicaid Choice. If you need assistance in reaching out to your health plan or New York State Medicaid Choice, resources are available to you, including A2R, CHAMP, and ICANN. And the New York Medicaid Choice number was on the slide in case you need it for reference. Thanks, Chris. Okay. So here you'll see the two menus of services. On the left-hand side are the services available under CORE. And on the right-hand side, you'll see the services available under BHHCBS. As of today, in January 2022, all of these services are still considered BHHCBS. But starting February 1st, these 4 services in BHHCBS will become core services that you see in the left-hand side. That is something the state is currently working on and will become effective February 1st. Both of these benefits are available under HARP and HAB SNP plans for eligible individuals. And you can choose to receive services through CORE or BHHCBS or both. You can also choose to access different services from different providers. For example, you might want to get education support services from one agency and peer support from another. That's totally allowable. The rest of today's conversation will focus specifically on core services, what core services are and how can they help you meet your goals. Next slide, please. Okay, we can take a quick break to answer any questions or get some feedback or some sharing, unless you want to move on to the next piece of this presentation. So, Chaplain, I'll let you decide whether to move on.
Oh, I'm sorry, I was on mute. This is a great time for feedback, questions, and sharing. And let's keep the sharing until a little bit later. Does anyone have any questions? And we'll take 1 or 2. If you could just, I see John Gunther has raised his hand. Please tell us your name and please get right to your question.
Yes, hi, good afternoon, everyone. My name's John Gunther. I'm the resource specialist with NYC Well in the city here. And I have a question about the relationship between the health home services and because I'm familiar with many of these from past work in case management. So does one still need to be enrolled in a health home now to be eligible for HARP and BHCBS services? I hope the question was clear.
Yeah, that's a great question. I'm sorry, I wasn't sure who was going to answer it, but I'll go ahead. So we are covering this in the next few slides. And the great news is that a referral doesn't have to come through a health home. There's no wrong door. So we're actually really promoting self-referrals or connecting with any of your other providers to make a referral. However, the health home care coordinator is still going to be an important piece for those people who want that level of service. And so if you have a care coordinator, they're a great resource and they can help you connect to core services specifically, but it's not required. You can self-refer to core. Now with BHHCBS, everything is staying the same. So those services would still need to go through a care coordinator or a recovery coordinator, but with core, we have the flexibility to open that front door wide open.
Great. Thank you very much.
Yep.
Thank you, John, for that question. We have time for 1 more. If you can just raise your hand. I don't see your hand. Okay. Well, I have a question, but really it's like a point of clarity. Sometimes, since we work in the field, we start to talk in alphabet soup. And even though now I'm working in the field, I forget. So what does CHAMP mean, C-H-A-M-P, and what does ICANN mean? Emily or Katie?
I don't actually know those acronyms. I only know the organizations by those names.
Okay. And then also,
Hey, Sandra.
Chaplain, we can answer that, but we actually have a slide about that later on. So we'll postpone answering that till we get to that slide, if that's okay.
That's okay. I want us to really be careful about our acronyms. And then also you mentioned the algorithm. So I've been with the HARP plan, Health and Recovery Plan, for quite a number of years. And I got something in the mail and I didn't know why and how. And so I want to thank you, Katie, Emily, for explaining how did they get my information, or how was I deemed eligible? Because I was using a lot of services. I was going into the ER, I was going to my clinic, I was going to many different doctors. I had a lot of complications. And whenever I went to the doctor, those algorithms were used and say, hey, she would do better with a care coordinator to coordinate all of the stuff. She's going through a lot of stuff. So therefore, that algorithm really worked. I always wondered, how did I get that in the mail? And how did I get immediately, automatically put into a health and recovery plan? So I wanted to say kudos to everyone in ONH and Oasis and now together CORE. You're really doing your job, because that's how they got me with the algorithm. They saw that I needed a lot of help and I was enrolled into the health and recovery plan. So thank you for spelling that out. So if there's any, we're going to move on because I think we're doing really good on time. Thank you so much.
Great. Okay, so this is Katie speaking, and I'm going to talk to you about what are core services. Next slide. So I'm going to start with just a brief overview of some facts about core services, and this applies to all 4 services that I'm going to go over in more detail. So this is what you really need to know. Number 1, these services are available in the community. Staff are going to meet with you in the places where you live, work, learn, hang out, and socialize. It's a mobile, flexible support, and the core providers will work with you to figure out where you want to receive those services. So it's incredibly flexible and personalized. Core services may be available by telehealth. So that's something you can talk to a core provider about, whether they have that as an option. If they do, they'll work with you using a person-centered approach to determine if that's the right level of support for you. The great thing is that you can blend telehealth and in-person services to get the level of support that you need. You don't need to choose one or the other. And of course, with the COVID-19 pandemic, if you're just feeling like, oh my goodness, the numbers are spiking, I want to switch to telehealth, and then maybe in the spring and summer, things get better and you want to do in person, that's going to be totally okay. And you can work with your provider to schedule that. Core services should be easy to access. So this is really good news because you don't need that standardized eligibility assessment. You don't need to join a health home. And you don't need a referral from a care coordinator or a recovery coordinator. You can self-refer to these services. We've really reduced the number of barriers needed in order to sign up. The amount and kind of services and supports are going to be based on your individualized service plan, which is developed between you and the core provider during the intake process. Next slide. Okay, so there are 4 separate types of core services. Empowerment services, peer support, family support and training, sometimes called FST, so there's another acronym for you, psychosocial rehabilitation, or PSR, and community psychiatric support and treatment, or CPST. The next few slides are going to go into a little bit more detail about each of these so that you can figure out what you might be interested in and what will help you reach your goals. You could choose to receive just one service, or you could do any combination of these services. So it's really flexible. All right, next slide. Let's start out talking about empowerment services, peer support. This service was actually the most popular service under BHHCBS, or the home and community-based services. And that's really no surprise to me because peer support offers support from someone who knows what you're going through because they've been through it too. They could share their own recovery story with you, offer support, and help you navigate the system and your community. So on this slide, you'll see a few examples of what a peer specialist could do for you. They could help you get engaged in the communities of your choice. This could mean finding a book club at a local library, joining a gym, finding a community center or a faith community. They want to help you find some place that's meaningful to you, where you can really engage with others and build social supports, relationships, and feel like you're living the life that you want. A peer specialist can help you build self-advocacy skills and knowledge so that you can confidently advocate for yourself with your family, with your landlords, with doctors, with a care coordinator. They want to make sure that you're able to speak up for yourself and navigate that system. They can help you find and get the supports that you need. And what I mean by that is they could help you find Social Security, a recovery center, warm lines, care coordination, a primary care doctor, even an online peer support community. So they're going to figure out with you what it is that you need and help you get those things independently. The idea is that they want to find the supports that are going to fit your lifestyle. Finally, a peer support specialist can help you when and where you need it most. So these services are provided at home, in the community, day, evening, weekend, locations of your choosing. So just like all core services, it's incredibly flexible. Now, I want to give you a brief example of how peer support could potentially help an individual. Many people have experienced difficulty speaking up in a doctor's appointment. It can be really intimidating to be honest with your doctor and share your questions and concerns, especially if they seem rushed or like maybe they aren't listening to you. A peer specialist could actually attend an appointment with you as a support who can give you confidence to speak up and ask your questions or make changes to your treatment plan. They can also share their experiences with you around self-advocacy and getting the medical establishment to take them seriously. A peer specialist could help you think of and rehearse questions in advance. These are just a few ways that a peer can help you with self-advocacy and building your knowledge so that you feel empowered to make informed choices and to take control of your healthcare. All right, next slide. Family support and training, or FST. This is offered so that your family of choice can be involved in your recovery. And what I mean by family of choice are the people you live with or who otherwise provide support to you, and the people you choose to call your family. It could be your parents, significant others, children, relatives, mentors, roommates, whoever you choose. Through FST, you and your family identify goals, strengths, resources that will support your recovery. This service is all about you and how your family can support you. Your family of choice can receive education on how better to support you, and they can develop the skills needed to maintain a positive relationship. I'll give you a quick example of how family support and training might help an individual. Some individuals have very strained relationships with their parents. Maybe this individual loves their parents, they just don't see eye to eye on life choices. Parents of adult children often think that they still know what's best, and that can put a lot of stress on a relationship. If you find yourself in this situation, family support can be incredibly helpful. They can help your family understand your diagnosis and how it impacts your day-to-day life. A family support and training provider can help the individual's parents get good factual information about mental health and or addiction, including information on recovery, which is so important. They can help with the individual and the family to improve communication skills and set healthy boundaries so that everyone feels heard and respected. All right, next slide. Psychosocial Rehabilitation, or PSR. This is the jack of all trades service. It's also incredibly popular under BHH CBS, and I think that's because it's all about helping people to get the life they want, improve your life satisfaction, improve your wellness, whatever that means to you. PSR is incredibly popular, as I said. It focuses on goals that have to do with where you live, work, learn, socialize, or hang out. Through PSR, you can get supports at home, at your job, or in the community. You'll develop the skills that you need to improve your life satisfaction and wellness. And by skills, I could mean a variety of things. It could be mindfulness exercises, banking and personal money management, job search and interview skills, harm reduction techniques. These are all skills that you can learn through psychosocial rehabilitation. You can also learn to manage stress, prevent crisis, and get the quality of life that you want. You could learn and apply skills to manage your mental health and addiction concerns to reach your recovery goals. It's really a flexible service. And there are so many examples of how PSR could help an individual. I'm going to highlight just one example of perhaps an individual who wants to move out of a community residence or their family's home into their own apartment. So in this example, the psychosocial rehabilitation provider will work closely with an individual to figure out exactly what skills they need to develop or refine so that they can be successful in living on their own. They'll also look at what resources are needed for that individual to live on their own. And they'll help them navigate benefits that might be available, like rental assistance or housing vouchers. At the same time, they can help that individual learn personal budget skills and money management so that they know how much they can afford. The PSR provider will be there every step of the way to make sure that the individual is making progress towards their goal. And if something isn't working, if they're not making progress, they can change their approach to move the person forward. All right, next slide. The last of the 4 services that I'm going to talk about today is Community Psychiatric Support and Treatment, or CPST. And this is a service that's provided by licensed professionals like therapists and doctors to address barriers that impact your everyday life. So think of this like mobile therapy. With CPST, the therapist or clinician comes to you. You can receive therapy and supports on your own, or you could invite your family to receive therapy with you in support of your recovery goals. CPST also offers support for people living with both mental health concerns and addiction concerns, including tobacco use, in achieving recovery and getting the quality of life that you want. So if you've ever tried to navigate multiple systems because perhaps you have challenges with both addiction or mental health, CPST means that you could get all of those services from a single provider, which is incredibly helpful. I want to share with you one of the most common examples of CPST that I've heard over the years. So many individuals have tried therapy and counseling, and for whatever reason, it just didn't stick. Transportation issues, scheduling issues, or just the stigma associated with going into a clinic can be really challenging for some individuals who want therapy. They just haven't been able to stay consistent. CPST allows the therapist or clinician to come to you. With flexible scheduling, you might meet with your therapist in your living room, or you could say, let's go for a walk and enjoy some sunshine in a local park or right in your neighborhood. By doing this, you can reduce those barriers to therapy and get the support that you want. Some providers of CPST will even have doctors and nurses available. So if medication therapy or managing chronic health conditions is something that you're interested in, you can talk to your CPST provider and see if they have a psychiatrist or a nurse practitioner or a nurse who's available to offer that level of support. Okay, next slide. I know I've spoken very quickly, and that's because I really want to hear from you. So it looks like there have been perhaps some questions in the chat, and I'll turn it over to Chaplain Mitchell to lead us through some feedback and questions.
I'm sorry, I was on mute again. Thank you so very much. I want to thank you for speaking about the stigma and speaking about us being able to have choices. That's very important, as opposed to someone say, you know, okay, you have a diagnosis and this is what you got to do. You talked about giving us the power, you know, giving the person the power and the dignity and respect back. So thank you so much for that. I see who had their hand up. Can someone help me? Their name, Olivia.
Oh, Olivia.
Cole. Olivia, can you please come forward and ask your question?
Hi, I'm Olivia. I'm with New York Project Hope for OMH. And I was wondering how you were talking about the stigma associated with going into clinics. I'm wondering, with this core program, have you noticed a difference in how people approach that, considering the shift to telehealth? How has that changed the way psychosocial rehab and psychiatrists are doing this? I'm just wondering if there's any changes.
Yeah, so I know that people from other parts of OMH have actually done a number of surveys to talk to people who are receiving services about their experience with COVID-19 and telehealth. I'm not sure if anyone from the Office of Consumer Affairs can speak to that, but you're absolutely right that the shift to telehealth, both for our outpatient clinics and for BHHCDS, has been huge, and it has reduced barriers related not only to stigma, but to transportation and other issues like that. So I guess I'll see if anyone from OCA wants to comment on the survey and what we're actually seeing in terms of feedback.
Yeah. Hey, Katie, thank you for that. This is Amanda Stake. Hi, I'm the Director of the Office of Consumer Affairs. This has been a great conversation so far. The survey that Katie mentioned, where we asked directly people who participate in the services, what their preferences and their experiences with telehealth were. And there were generally 86% of the people who responded to our survey said that they were pleased with the option of telehealth. Some people said that they wanted a balance, like Katie mentioned earlier, like having some telehealth and some in-person services. Some people shared that that they preferred seeing someone face-to-face, that was less awkward than telehealth. So I think the headline on what we learned from the survey kind of supported the direction where CORE is going, which is that it's personalized, and the individual can decide what is best for them, what they feel most comfortable with. And we think that flexibility has really helped people connect to their recovery in ways that they hadn't before. I hope that helps.
Yeah, thank you. That was very informative. Thanks.
Chaplain Mitchell, you have a few questions here. There's one in the chat about how do we find CORE providers?
And can we switch and spotlight the other interpreter, please?
Yeah, I think I saw something with housing. So I see the hand up and I see some in the chat and they're all on top of one. So how should we do that? I saw Marta first and then I saw the chat. Can we do it in that order? Marta?
Hi,
come forward.
I just want, my name's Marta, and I'm a peer specialist with a brand new IMT team. And I just wanted to say, when you said peer support was the most popular, it made me feel really good because it's really exciting being on a brand new IMT team, because we bring the services to the person, and everything you said, it's just so exciting because we're just starting now. All our teams are brand new. So I just want to thank you for that, for everything that you said. And it also sheds some more light on what I need to do in my job. So thank you.
That's fantastic, Marta. I'm so glad that this is really speaking to you. I'm not familiar with the acronym INT. Could you just tell us what that means?
It's like an ACT team. It's a mobile team. Everybody's on the team. The nurse, the psychiatrists, the social worker, the harm reduction specialist, and 2 peer specialists. So and we all go to the person. We all find, even if we can't find them, we go looking for them on the street. We go to them wherever they are, people who fell through the cracks. So we go to like Rikers Island, to shelters, or on the street, or if they have housing, we go to their home, and we keep in touch with everybody daily.
That's fantastic. Thank you so much for sharing that. I'm sorry, Chaplain Mitchell, I didn't mean to jump in.
Yeah.
No, this is excellent. We're really talking, we're really having like a conversation with each other, right? And that's what what I want this to be like. Thank you both so much. Dennis Wetzel and then Mark Iskowitz, and then we'll go back to the presentation. Dennis, if you could come forward, and directly after Mark. Dennis, are you on mute? Dennis had a question on how do we find CORE providers? Dennis? Okay, so can we just go ahead and answer that question? How do we find CORE providers?
Yeah, so the section coming up is actually how do I get CORE services, and we're going to talk about that. So I won't go into too much detail. I will just say that you have a few options. We do have a list on our website, and you can also talk to your managed care organization or health insurance plan to find out who's in network. And I promise to go into more details, and we can revisit after the next section if there are additional questions.
Excellent. And the last question for until we go back to the presentation, Mark Itzkowitz, he wants to know, can someone get core services if they live in a supportive housing program?
Yeah, so this is a great question. And the answer is yes. If you reside in OMH supported housing, which I'm from the Office of Mental Health, so I can only speak to OMH. I can't answer if someone's in an OPWDD supported apartment or OASAS. I can only answer for my state agency. And the answer is yes, absolutely. People who are in supported apartments, who are receiving services in community residence, all of that is fine. We want to make sure that we're supporting people who are receiving housing and residential services with whatever their goals are through core services.
Thank you so very much. And so we're going to go back to sharing some more information with our public.
Great, thank you so much. Okay, so this is still Katie talking. I'm just going to take us through this next section. How do I get to core services? So I've told you what they are and who can receive them. And now I want to look at how people can actually get them. Next slide. So I'll start out by saying that the biggest takeaway I have for you today is that there is no wrong door to core services, meaning that there's no wrong way to get a referral or to get to a provider. If you've received BHH-CBS, then you know that these referrals used to go through a care coordinator or a recovery coordinator, and that is still true for the services that are remaining in BHH-CBS. But for the 4 core services, there is no wrong door. You could talk to your care coordinator if you have one, but you could also talk to your health plan or insurance company. You could talk to your doctor or primary care, and you can even self-refer, which is huge. And I think that that's going to be so important for this population to feel empowered to pick up the phone or send an email over to a core provider and set up your own intake. That's completely possible. So on this slide, you just see some of the pathways. You're not even limited to what's on here. If you can find any other individual who wants to help you get to core services, that's completely fine. Now, one thing that you might wonder as you look at this is, okay, maybe there's no wrong way, but is there a better way? Like, would one of these get you an intake appointment faster? And the answer should be no. As soon as a core provider gets your referral, your intake request, they should schedule that appointment just as soon as they have availability. So if you get that referral through a care coordinator, through a doctor, or if you self-refer, it wouldn't make any difference in terms of how quickly they're able to meet with you. So that should be good news. All right, next slide. Now, as I mentioned, there's no wrong way to get to core services. In fact, there are multiple ways and all of them should be pretty much equally good. We hope that anyone who's eligible for core services and who wants core services is able to get there as quickly as possible without a bunch of hoops to jump through. So here's a few ideas for you if you're interested in receiving core services, or if you're a peer specialist who's joined us today and you're considering how you might support individuals with accessing these services. So first, you can go ahead and reach out to the core provider directly, make a self-referral, and start that intake process as soon as possible. If you do make a self-referral, you'll want to make sure that the provider accepts your insurance. So whether you're receiving Fidelis or United Healthcare or Emblem, whoever your insurance company is, you'll just want to let them know right up front so that they can confirm whether or not they're in network. You can also find a list of core providers on the OMH website, and we can get that link to you. I can actually try to drop it in the chat after this. Or if you don't want to go to our website, we've got other options. You can contact your health insurance plan directly and they will tell you who's in network. They might even help facilitate that referral for you, because they might, they might have a name of someone at the agency. So it's not just a cold call. They can say, oh, here's the intake specialist. Here's who you need to speak with. And lastly, if you do have a health home care coordinator, this is a really good resource for you. That's their whole job, is to help you get services and connect to the providers that you're interested in. So, if you have a health home care coordinator, talk to them and they can help you navigate this process. All right. Now, just like any other benefit covered by insurance, the core provider does need to document medical necessity. So in this case, it means getting a recommendation from a qualified provider known as a licensed practitioner of the healing arts, or LPHA. So there's another acronym for you. The core provider will get this form completed during the intake process. If you're interested to see what the form looks like, we do have a link right here on this slide, and we can get a copy of these slides to you. So it's linked right at the bottom there. You might be wondering who an LPHA is, like who counts as being qualified, and I'm going to give you some examples on the next slide. What I want you to know about the LPHA recommendation is that yes, it's important, but if you're interested in core services and think that you might be eligible, I don't want you to worry about getting the paperwork done. That's the core provider's job. So you can start that intake process. You can go to the core provider and schedule that first appointment, and they will worry about getting the paperwork completed. So I want you to know what the process is, but I don't want you to feel like it's your job to get a signature on this piece of paper. That's really, on the core provider. Okay. Next slide. So who are LPHAs? This slide is just some examples of who a licensed practitioner of the healing arts would be. As you can see, we've got psychiatrists, licensed clinical social workers or LCSWs, nurse practitioners, physicians or physician's assistants, licensed mental health counselors. These are all LPHAs. So a simple rule of thumb is that most licensed therapists or clinicians, doctors, and nurses are LPHAs. If you're looking for the complete list of who else is qualified, you can actually check out the recommendation form itself, which was linked on the previous slide, because we do have that list right on the form. Okay, next slide. Now, what if you're already receiving BHH, CBS, CPST, PSR, FST, or peer support? That was a lot of acronyms. So if you're already receiving community psychiatric support and treatment, psychosocial rehabilitation, family support and training, or peer support under adult behavioral health, home and community-based services, what does this mean for you? The good news is your services will continue. There should be no change. Your provider will work with you to update your individual service plan for core services. If anything, the changes you might notice are increased flexibility. You may be able to receive services at a higher intensity if that's what you need. And your providers may have more flexibility to work directly with your family of choice in helping you with your recovery. So if anything, it just means that you'll be able to get more support under this change, which is good news. So I think that that's it for this section. If you want to go to the next slide, I will pause here again and we'll accept feedback, questions, and sharing. Chaplain Mitchell?
Yes, I have a question. I actually am in a health and recovery plan, a HARP plan, and I do have an appointment today. And you just sparked something in me. I need to, in addition to physical therapy, I need to get into some type of gym or something. I've just been kind of sedentary, especially because of COVID. Do you think I can have that conversation with my care coordinator?
Oh, absolutely. If you're receiving health home care coordination, they might be able to brainstorm some solutions with you. Perhaps your insurance company has some sort of benefit available. I know that some HARPs do, or they might be able to point you in the direction of gyms and fitness centers in the community that have financial aid and things like that.
That sounds good. Thank you. So I am motivated and I have some work for my care coordinator to do. Thank you. Is anyone in the audience? Yes, Juliet. Juliet, I don't want to butcher your last name. Please say your last name. Come forward.
Oh my God, wait, did you just say me? Sorry.
Yeah, I can, yeah.
Okay, sorry, my Zoom's being weird. Okay, yeah, I just wanted to clarify the process of kind of the referral process. So, you can self-refer, clients can self-refer if you have HARP and access to the core services. But then once you're actually receiving the service, the provider has to fill out that LPHA form. let's say, for example, they determine that the services aren't necessary, does that like almost negate the self-referral aspect of it? They can deny the service? Is that possible?
So I know Frankie is going to talk about grievances and appeals, and so that will be in the next section. The services do need to be quote unquote medically necessary, which means you really need a goal and the provider needs to feel that they can help you with that goal using core services. So just like I can't make an appointment with a neurologist if I don't have an issue with my brain or nervous system, you can't receive psychosocial rehabilitation if you have no rehabilitation needs. Now, I think many, if not most HARP members could benefit from one or more of these services. But that's, a personalized conversation that needs to happen between the individual and a licensed practitioner of the healing arts. So it is conceivable that you would meet with them and they would say, we actually don't think that these services are necessary for you at this point in your recovery. You've got a few options at that point, and I think that Frankie will go through those. I think that's probably as much detail as I can go in right now.
Excellent.
Thank you. Yeah.
And if you have any further questions, we're going to have, this is for everyone, we're going to have breakout rooms so that we can, talk a little bit more or answer your question if you didn't get to ask your question. And so I see a hand up, Brother Philip Williams-Cook, who's part of the A2R group. And I did not introduce everybody, but we're going to do that because we are a new group. So Philip, can you please come forth and ask your question?
Sure. There's a question in the chat, and I have the same question as this person. So I'm just going to read it. Are supportive housing providers going to be among the Not Wrong Doors program?
Thanks, Philip. So, that slide is just intended to be examples. It's not a complete list. So there is literally no wrong provider that could facilitate a referral. Supported housing, 100% can make a referral. Any provider or any person can make a referral to core services. There is no wrong way.
Thank you.
Thank you for that question. So I'm going to be transparent and ask the team at this point, do you think that we can tell us could I introduce the A2R, the Access to Recovery group, our wonderful group? Or should I wait? What do you think? I want to show off.
This is Frankie. I mean, I think that we're running a little bit short on time. We're at 2:30 and we want to have some time for breakout sessions. We do have a little bit of presentation to get through. So maybe we'll see how quickly we get through the rest of the presentation. And then if we have time, we can do some very quick intros.
Yeah. So let's go forward. Thank you, Frankie, for that. And let's go forward with our presentation. Katie, are you still presenting?
Nope, I'm kicking it back over to A2R. I believe Frankie is presenting these slides.
All right. So Frankie?
That is correct. Okay, so welcome everybody. Thanks for sticking with us so far, spending your afternoon with us. My name is Frankie Herman. I work for the Urban Justice Center Mental Health Project. We are the home of the Access to Recovery Coalition. And I'm going to review in all these systems, there's always barriers. Even the best designed system is going to have some problems. Anybody who's ever tried to access HARP services knows that you can come across a variety of different issues. So when that happens, who do you reach out to? Next slide, please. So the first question is what kind of legal help is available? There's a whole range of things, and it's important to know that this legal help that we're going to kind of describe is free and it's confidential. So some of the things that you can get is if you just want advice on how to resolve the issue yourself, what are my next steps? What are some options? What are some limitations? That's something available. If you are looking for a little bit more involvement, you want an advocate to, investigate a possible violation of your rights, something that didn't go well for you and work on that complaint with you, that is also an option. And these can kind of go with steps too, right? Let's say you try to resolve it yourself first, and that doesn't work out, and you need a little more support to kind of push it a little further. And the third kind of option is full-on representation and advocating for your rights. So that would be somebody who, depending on the organization and where you're located, potentially could include representation at a fair hearing, which is it's basically a type of court procedure in which a judge would determine, let's say, for example, the insurance company denied you access to a certain Medicaid covered service that you wanted, and advocating didn't work out, and then you can file your own fair hearing and you want somebody to help you out. Then the judge would decide, was the insurance company correct in this denial, or are you correct in that it should not have been denied? Next slide, please. So just kind of repeating that information again in a written way as opposed to a visual way, because we're all different types of learners. So if you have problems, if you have questions, you just want to understand how something even works, you can reach out to expert advocacy. You can reach out yourself. You can reach out on behalf of a friend or a family member. Now, at a certain stage, that friend or family member is going to have to get involved, but you can reach out to just ask basic questions as well for any issues in accessing your Medicaid substance use and mental health supports. Again, we can advise you how to file a complaint and appeal yourself. We can help with investigating and resolving complaints and violations of rights. And in some cases where the case has merit and a few other factors, we can represent you to help advocate for what you want. And again, it's all free and confidential. So, next slide, please. So there's two phone numbers and emails here up on the screen for folks who have their videos going. There's what's called ICANN. It's an acronym. It's for the Independent Consumer Advocacy Network. The HARP, we are a statewide specialist in Medicaid HARP. It's through the Urban Justice Center Mental Health Project, and we can assist basically anyone who has or wants Medicaid HARP or has questions about Medicaid HARP, or if you're trying to, including folks, if you have Medicaid HARP but you have an insurance issue that's not HARP related. So for example, let's say you have Medicaid HARP, but that's going well, but your actual issue is that you need more hours for your home health aid. As long as Medicaid HARP is that type of insurance that you have, we can also assist you with advocacy in those cases. There is also CHAMP, which is the Community Health Access to Addiction and Mental Health Care Project. They are statewide specialists for all substance use and mental health care, regardless of what type of insurance you have, or if you have no insurance at all. So kind of the difference between the two is they have a more broad sort of general expertise, and sorry, when I say they, I mean CHAMP, and ICANN has a specific, very deep HARP knowledge. There's also really no wrong door to these. If you're not sure exactly who to reach out to either one and maybe both and see who gets back to you more quickly. Or if we're not the ones who can help, we're certainly happy to do a referral to somebody who can for both organizations. Okay, next slide. So what kind of actions can happen if there is a problem? Typically something I might do is first try to reach out to member services or a member services supervisor, member services meaning at your health insurance plan, and see if there's an issue that can be resolved that way. Or it could be member services or services supervisor at your health home, kind of whatever agency it is that that there's some an issue that needs to be resolved. You can reach out to their member services or their quality services folks. A complaint or grievance can always be filed, again, depending on what the agency is. Maybe it's filed with the health plan, maybe it's filed with the provider, maybe it's filed with the health home, depending on what the issue is. And sometimes all multiple agencies need to be alerted towards the issue. And then also you can file a complaint, grievance, or fair hearing with the state. These are all separate processes, and that's something that we'd be happy to advise you on, kind of like what those processes are, what the time deadlines are. So especially with a fair hearing, there's some steps that have to be taken before you're allowed to file a fair hearing, and there's some deadlines. So the one thing I would say is if you ever get a denial of services letter for something that they're trying to deny you a service or reduce your services, you'll want to respond to that right away, because there may be some rights that you can retain that you'll lose if you don't respond within the deadlines. And that's, if you get that letter, feel free to call either ICANN or CHAMP or both, and we'll help you figure out what the next steps are and what your options are at that time. And if you do call, both, we can't represent two people. Like ICANN can't represent you at the same time as CHAMP is representing you, but maybe one of us is able to get back to you more quickly or is better able to provide you a service. So you'd work with one of us, but not both necessarily. Okay, next slide. Okay, so I'm going to pause for some quick feedback. And well, actually, I want to go over just one quick thing. So we're going to next, just as a kind of topic shift, next we're going to do breakout sessions. And I just want to let folks know, if you want to be in the room with the ASL interpreters, send me a direct message through the chat so I can make sure that I assign you to the correct room. But we'll take maybe just one question and I'll pass that over to Chaplain Mitchell.
Yes, Philip, I see that you have your hand up and I will acknowledge you in 1 second. Do we have anyone from the audience that has a question? Just to be fair, anyone who is from the audience that has a question?
Oh, I also want to let folks know, in case you didn't see in the chat, that we'll be sharing all these slides with you after the town hall is over. So don't worry about having to write those numbers down. You'll have those in your email inbox.
Thank you for that, Frankie. Yeah, it's very helpful when we do have the slides made available, because sometimes, we'll read it over and then we have more questions. So thank you and for mentioning that. Okay, there's someone who has not spoken before. Dan Frey.
Hi, everybody. Chaplain Mitchell, it is such a pleasure seeing you in the spotlight. I just want to say that. But my question is, how, if we have a lot of grievances, that means we're not happy with the agency that we're connected to through HARP or whatever. How easy is it to just drop one provider and give another one a try?
So I would say that depends on the specific provider. So for example, if it's your doctor, very easy. You can just go see a different doctor for the most part. There are some limitations, like you can't see one every single day. But I would say if you have questions about that, you can contact us. Health homes are a little bit more slow. There's a disenrollment process that you have to go through before you can then be enrolled. So there might be a gap in you having those supports. But if you ever have a question, specific to your situation, please feel free to give us a call, and we're happy to kind of go into, for you and when your exact circumstances, what does that look like and what is your timeline and your options?
Thank you, Frankie, for that. And thank you, Dan, for asking that question. It can get a little, stressful. And thank you, Frankie, for mentioning that when you're switching from one provider to the next or one service to the next, it could be a little gap. And so we want to be very, very mindful of that. So in an interest of time, Frankie, can we go into the breakout rooms?
Yep. Yeah. Let's just go ahead and do the breakout rooms, and it'll take me a little minute to get everybody assigned. So if you're not in there just exactly when I break folks up, don't worry about it too much. You'll get there.
Wonderful. We'll exercise patience and keep a good attitude.